We all know that the HSE is a failing, bloated mess. Anyone who has had to suffer through the public health system knows this all too well. Underfunded in the areas that need it most, overfunded at the top, and no desire to change. How many useless health ministers have we had now, each as bad as the last, or worse, all utterly incompetent and utter failures in their brief? A&E overcrowding is never-ending and only getting worse. Wait lists are growing, and primary care is buckling under the demand and dwindling resources. We have a shortage of doctors, nurses, care staff, GPs, therapists, dentists, you name it, we need it. We have one of the best funded health services in the world. Billions upon billions pumped into it each and every year, and what have we got to show for it? A creaking shambles that is failing so many people in so many ways. But the past few weeks have thrown into sharp relief just how badly our crumbling health service is failing our children. We had the news that over 100,000 children are now on a waiting list for first-time intervention in primary care for services such as psychological, occupational, and speech and language therapies. We heard that once again the HSE and the state are failing those children who are waiting on spinal surgery. The figure is now approaching a 5-year high, despite Stephen Donnelly making extra funding available so that no child is waiting longer than 4 months for surgery. We also heard how the Child and Adolescent Mental Health Service was unfit for purpose and had ever-growing waitlists. And the cherry on top was the revelations that the state has spent €1.2 million defending court cases of children waiting for an assessment of need. Our government is actively fighting parents of children who are only asking for what the state is obliged to deliver. So there's a lot to unpack here, and all of it is bad. The wait lists are, quite frankly, unforgivable. Thousands waiting not only for initial treatments, but initial assessments and consultations. Hundreds more waiting for life-changing surgeries. It is quite frankly despicable behaviour from the state, and that is to say nothing of the court cases. The consequences of these failures are devastating. When it comes to the assessment of needs, for example, and the various therapies associated with it, every parent is told from all angles that the earlier the intervention, the better. And yet, there are thousands waiting to find out what treatments and therapies are even needed in the first place, and then face another wait to actually start those treatments. The Dáil was told of a 1-year-old child whose parents were told that they would not get an assessment of need appointment until 2028. Now let me say that again, 2028. Assessments of need are meant by law to be undertaken within 6 months, and yet rarely are. Those court cases that are being fought by the state to the tune of €1.2 million are being brought by parents whose child is waiting longer than what the state is obliged to deliver. You have to wonder how many more parents would like to take a case to court, but do not have the funds available because they have instead scraped the money together to go the private route and can't do both. And then there's CAMHS. Huge increases in the waiting lists for such a vital service, yet it is a service that cannot be considered safe, effective, or evidence-based, according to the Inspector of Mental Health Services. You'd be hard-pressed to find a more damning indictment, and that's saying something given our piss-poor record on mental health across the board here in Ireland. But this is an unforgivable dereliction of duty. The delays to spinal surgeries are yet another unforgivable act. Hundreds of children in extreme pain with no relief and no end in sight. In one horrific case brought to light, a child was left unable to breathe at times due to a 5-year wait for spinal surgery, during which time her spinal curvature deteriorated from 30 degrees to over 135 degrees. Do I need to say that this is not acceptable? Does it really need to be said? Apparently it does, because the government are still twiddling their thumbs and doing nothing about the wait lists. Oh, but now, finally, they're considering outsourcing the surgeries abroad to help tackle the wait lists. Just in the nick of time, eh? It's not like this has been going on for years or anything, during which time hundreds of children have needlessly suffered. Unforgivable. Oh, and by the way, outsourcing doesn't help those children who are too sick to travel. So what about them? Just left to suffer on the waiting list, it seems. And then, of course, there are the court cases. €1.2 million spent fighting parents who are just looking for their children to be taken care of. Sickening behaviour. Money that could be far better spent actually helping the children at the heart of the cases. But no, just like with everything, the state would rather fight than admit liability. And all of this is happening while the children who need help are forgotten by the state. Just another number on the list that they'll get around to eventually. Parents abandoned and left to deal with their children's needs as best they can, all while watching their child suffer before their eyes, all while worrying that their child is missing out on their best chance at effective treatments and therapies and falling further behind and through the cracks. Being a parent is hard enough, adding this extra stress and strain is just cruel. Child abuse by our government is what all of this amounts to. And the worst part is that this could be fixed. Firstly, we have a ridiculously high health budget, and secondly, a ridiculous budget surplus, a ridiculous surplus, by the way, that is expected to get even more ridiculous over the next few years. Available funding is not the issue. Actually using it effectively and efficiently is. See, our government think they're fantastic because of that surplus. They think that they're the mature, steady hands guiding our recovery, but what good is this massive tax take if they do nothing of use with it? All that surplus tells me is that the current government are mismanaging our finances to a ridiculous degree. They are taking in far too much while giving fuck all back. And let's not forget the chronic mismanagement of the new children's hospital and the insane overruns there. Investment is needed in children's healthcare and healthcare in general across the board, and that means actually paying a decent wage to the frontline workers. More than a decent wage, if we're being honest. We need to attract the staff with a good standard of living. Frontline healthcare in all its shapes and sizes is not an easy job, but it is a vital job, and one that should afford a stable roof over a healthcare worker's head close to where they work and a decent standard of living. Or, pay them a decent wage and make housing, groceries, energy and just being alive really affordable again. Leo Varadkar, current Taoiseach and ex-Minister for Health and a doctor himself, when talking about the deficits in supports for children, said that if it was about signing a cheque or a statutory instrument, they would do it in the morning, but it's not. Now, I very much disagree with this statement. They could sign a cheque and fix the issues. Pay the staff a proper wage and you will attract more into those professions. In my estimation, the reasons for the staff shortages in these key areas, which Varadkar admits to, by the way, is that they require a lot of dedication and effort to become qualified in. And if, after all that hard work, you can't keep a roof over your head or put food on the table or, be independent because the pay is not good enough, then what's the point? Those who are trained and qualified are leaving for a better chance at a decent life, and those considering training in these areas are put off by the poor outcomes. And again, can we all see how nearly every staff shortage in this country circles back to the housing crisis and the cost of living crisis that the government are happy to just let run amok? It is infuriating at this stage. We have heard time and time again by the government that to attract the top talent, you have to pay the top wages. We've heard it when defending the pay of the higher-ups in the HSE. We've heard it about the stars and the higher-ups in RTE. We've heard it about every area of the public sector. And yet we've never ever heard it about the frontline staff, the ones who we actually rely on. Maybe if we started paying our frontline healthcare staff across all disciplines and including carers an attractive wage, we wouldn't be hemorrhaging talent to the likes of Australia. Maybe, just maybe, we could give our healthcare graduates a decent life at home in Ireland, and the population would see the benefits and reap the rewards of a properly staffed health service. The government have the power and the resources to fix these issues, but won't. Now is the time to invest properly, to pay good wages, to attract the best staff, and commit to the children of this country. Until then, our future is being ignored and cast aside, our children forgotten and left to suffer. Until then, our government is happy to allow this child abuse to continue. So what do you think about the chronic failures when it comes to our children's healthcare? What are your experiences of the systems in place that are supposed to help our children? And what do you think can be done to solve the never-ending problems in our health service? Let me know in the comments below. Don't forget to like, share, subscribe and hit that bell icon to be notified of new content. If you want to support the channel, you can now buy me a coffee, which is greatly appreciated, and a huge thank you to those of you who already have. You can also follow me on Twitter for my real-time reactions. Yeah, I'm going to go ahead and keep calling it Twitter. Anyway, until next time, slán go fóill.